You are very welcome to this video, and you don't need me to tell you that things aren't going very well at the moment, but hopefully we'll unpack this a bit, and we'll have some suggestions for what's driving infections, where things are being done well, and hopefully understand things a little more as we get time to look at some research. But we'll do some basic news first and then see how we go for time. Now, I'm going to start off with the United States today because let's just say the attention of the United States has been distracted over recent days, and yet things are getting dramatically worse, and we'll see that the situation is also getting dramatically worse in the UK as well. We will look at Australia, where things are not getting dramatically worse. So moving on straight away to the United States, if we look at the trends actually from the Centers for Disease Control here. Now, I know you're probably getting a bit bored with seeing this graph now, but this is the numbers here. So we're looking at well under 300,000 new cases per day just there. But the latest number of cases is well over 300,000 cases. It's 310,000. So the next peak is going to be round about there where that yellow marker is. So we're looking at a dramatic increase that is going to be demonstrated on that graphic over the next few days. This is actually quite inevitable now. So latest numbers, that was the last 24 hours, 310,000 new cases. Up from that the day before. These numbers were still somewhat low after the Christmas lag. Now, Christmas New Year lag. I must say I am bemused by the fact that American data loggers or whoever does this take so much time over Christmas and New Year in the middle of a pandemic. I mean, just look at the size of the dip there. I mean, this isn't real. This is data lag due to holidays. I mean, it's it's surprising that that they were taking that time off. To be quite honest, this is a time we really can't afford to rest at all. Cases up 23% in the past 7 days. Now, this is a huge increase. Part of it comes from catching up over the holiday period, where more data is now being reported and they appear artificially high. But there's still been these genuine increases of around about 8, 9, 10% over the past 7-day period that have been there for weeks now. So week on week increase, 23% probably not quite that high. That's somewhat artificially inflated, but round about the 10% mark in real terms for some time now, and it just keeps going on. Now, testing in the United States is pretty good. Getting on for 2 million tests in the past 24 hours, still up. But the key thing to notice here is the positivity rate is 13.8%. Now, you probably know by now what this means is for every 100 tests that are done, 13.8% come back positive, indicating a lot of community transmission. This means that there are huge numbers of cases just waiting to come out now, waiting to be diagnosed, because it indicates there's so much community transmission. This community transmission is guaranteed to translate into cases, guaranteed to translate into people that require hospitalization, and also guaranteed to transpose into a certain number of deaths. So very high positivity rate. That's an average for the United States. It does vary a lot. We know that the southern states are badly affected at the moment compared to the northern states, but basically this is everywhere, although it is variable. But wherever you are in the United States, you really need to be switched on to this clear and present danger, because that's what it is. Hospitalizations up 5.3% in the past 7 days. Non-sustainable levels, 131,000. Nearly 24,000 in intensive care and nearly 8,000 currently ventilated. And we know that ventilated patients often don't do very well, so this is going to transpose into a certain number of deaths. The death figure we have here, the latest death figure is 3,915, although we believe that the last 24 hours, when that data is complete, will be higher than that. And we do actually see a death graphic here that's showing an average of just under 3,000 is the 7-day average, but increasing towards the end of the week. That's yesterday's data, Friday the 8th of January. So we do see quite a sharp increase in the number of deaths as well, unfortunately. Now, if anything, the reported deaths in the United States are an understatement. Dr. Fauci's on record as saying they probably miss more than they overestimate. So the number of deaths here in the United States is approaching 400,000, if this is indeed an underestimate, as it appears to be. We would say that's a conservative estimate of the amount of deaths. So the United States is in crisis. There's no other way to put it. And while its mind has been distracted on other things, this virus has not taken any time off to consider politics or other problems, quite genuine as those problems may well be, indeed are. The virus doesn't care. It doesn't care. It's just going out to reproduce as much as it possibly can. This is what the virus does. It wants as many of these viral particles in the world, infecting as many people as possible. That's what this virus is doing, and at the moment in the United States, doing it very successfully. Vaccinations sent out 17.3 million. Under 7 million people actually vaccinated. That's yesterday's figure. Okay, it's probably just over 7 million today. But this is poor. Very poor. There's no two ways about it. We expected 20 million by the end of the year. We're now well into the start of the new year and still under 7 or around about 7 million vaccinations. Now, Mr. Biden has said that when he comes into power, not long now, 20th of January, I believe, he's going to send out all the reserves of vaccine. So, in other words, the vaccines that are being kept back now for a second dose, Mr. Biden's going to send them out. Now, that is interesting because that goes against current Centres for Disease Control policy. So I think reading between the lines there, and I don't want to get political, I'm not, but I think we can expect to see fairly big changes in the CDC when Mr. Biden takes office on the 20th of January. Pretty big changes. So it looks like he has in mind, I don't want to put thoughts into Mr. Biden's mind, but from what he's saying, it looks like he's going to go for a similar strategy for the UK, where you give as many people as possible the first dose, because we are in a crisis. The alternative, I believe, is more people will die. It's not what we like to do. We like to be absolutely rigorously following the research guidelines, rigorously following them. But because we're in such an emergency situation, I believe that the British authorities made the right decision to go with one dose. Certainly my mind is clear about that with the Oxford vaccine. We could argue about the Pfizer one more. And of course the Moderna vaccines in the United States as well. But we take this time to notice that the European Medicines Agency and the FDA, the Food and Drug Administration, have not yet authorised the Oxford vaccine, which is easy to transport at low temperatures. But it's not done. So that's where we're at with vaccines. Disappointing. Really hope this is going to seriously ramp up, because even if the vaccination programme was completed in the next month by some miracle, which isn't going to happen. I mean, Mr. Biden says he wants 100 million doses in his first 100 days. That is achievable. The United States, when it puts its mind to it, can achieve this. I believe he can do that. And it looks like he might be going for this single-dose strategy in the first instance to stop people getting so sick, which we believe is the outcome of giving one dose after 2 or 3 weeks for the immunity to build up. So I believe the United States can do that. I believe it will do that, but it's not doing it yet. But even if it did do it straight away, that's not going to alter the fact that cases are going up dramatically now. It is inevitable that sick people will become more common, that more people will need hospitalised, and more people will die. That is baked in. We can't change that now. The vaccine is for the medium term. The short term, the cases are going to increase, I'm afraid. We just have to be prepared for that. Now, London. If you're in the UK, you might have caught that very, pretty moving interview, really. Dr. Zudin Puthucheary, London intensive care, intensivist consultant, and leader on intensive care medicine. Intensive care units in London are full beyond bursting, and I know from talking to friends in other parts of the country that is also true. Friends and colleagues in intensive care units outside London also full beyond bursting. So that was Dr. Puthucheary's precise words, full beyond bursting. More patients than we've ever had, less staff than we've ever had because staff are off sick and self-isolating. The rest of the hospital is full beyond bursting, and that's also true in many other areas outside of London as well. The resources they have, he says, it's not going to be enough. There's not going to be enough resources to look after the people that need looked after. The average age, he says, of people in intensive care in London is 60. In other words, there's a lot of people in their 30s, 40s and 50s in hospital at the moment. 90% of his patients were working before they were hospitalised. So all those are in the notes in the description, all those points there, as I always put them in the description for your perusal. Going on, he went on to say the mortality in intensive care is about 30%. That's pretty good. That's pretty good. 70% who survive are going to be disabled for years. What happens is when someone's really sick, you can't. The digestive system can't take on food as normal, and they become what we call very catabolic. So metabolism, there's anabolic metabolic processes which build up proteins and build up structures. There's catabolic processes which break them down. So when someone's sick, they need protein to make their antibodies and for the immune system. And the only way you can get that is from your muscles. So very poorly people lose a lot of muscle mass, and that can take a long time to recover. So even the people that recover can be disabled for years. This is going to be a major impact in morbidity for the next few years, anywhere there's a lot of very sick people. So even for the 70% that we're hoping survive intensive care, that it's going to take them a while before they're back to strength again. Younger patients, now again, we don't have data on this, frustratingly, but this is from Dr. Puthucheary. He says that younger patients are being admitted all around the country. So we don't have firm data on this, but the demographic seems to be younger in this second wave than in the first wave. I've heard several doctors saying this. I've heard government ministers saying this. I think the mayor of London say that. I'm not sure. But anyway, we're waiting for the data on that. But younger people do seem to be getting sicker in this wave. Now, whether this is due to the new variant in the UK, we don't really know, because the data initially show that doesn't make people sicker, and as far as we know, it doesn't make people sicker. But people all around the country, and that's the data there. To say the average age in intensive care in London is 60, which is known, is much younger than in the first wave. So remarkably concerning that relatively young people are getting sicker. Most have a mild illness, we have to stress, but the proportion is still there. Most staff are getting vaccinated in London, not everywhere around the country. Not all frontline staff are vaccinated yet. And he says decisions are likely to be taken away from intensivists. So in other words, basically what he's saying is healthcare resources are going to need to be rationed. And he was also very angry because transport for London footfall is double what it was in the first wave. People need to stay at home, and they are not. People are just not getting the seriousness of the crisis that we are in the United Kingdom and the United States. People just don't. Many people do, of course. The vast majority, I think, do, but some people are not getting it. They don't realise we have to stop spread by our behaviour. Or they choose not to. So data up to date as of Saturday the 9th of January. It's always 24-hour delay, of course. 680,000 cases on Friday in the UK. Extra cases. That was the day before. That was the day before. That was the day before. Official number of cases now diagnosed, 3 million, essentially. So 68,000 cases diagnosed. If we look at the, let's look at the COVID symptom tracker data. Again, we see that is 67,000 new cases. London, my area is actually quite badly affected up here as well. It's a big region there, so it doesn't quite show up, but my area's got a very high prevalence of the new variant, the 2012 variant, and there we see the overall number of patients or number of symptomatic people in the UK. Most of these with mild illness, thankfully. As of the 9th of January, 843,408. Moving on to the official government data, just look at the direction of these lines. I mean, these are just very, very rapid increases. And it really is, the healthcare provision is really quite a massive concern. We are over capacity now. Very high numbers. We are over capacity. Intensive care now reaching the capacity of the first wave. In some areas, very difficult already. And we know, as we've looked at, yesterday we looked at this, because of the number of cases in the past couple of weeks since Christmas, this will transpose into more people requiring hospitalisation. This is going to get worse over the next few weeks. It is a crisis situation. Number hospitalised, 3,600. This is the UK, 3,876. So that many in hospital now, just over 31,000. Not sustainable, nearly 3,000 ventilated. Deaths on Friday, 1,325, the highest number ever in a 24-hour period. It's yeah. Right, vaccinations. First dose, 1.296 million. Second dose, 21,000 have had the second dose. This number hopefully won't go up very much now for some time, but we hope this number will absolutely go through the roof. This is the one we need, and it will start going up soon, dramatically. I have no doubt, and it needs to. So that's the situation in the UK and the United States. Now, I think I've gone on too long today yet, so I think we'll look at Australia. Now, Australia, they're not going to start vaccinating till late February. A bit surprised. Yeah, I'm very surprised to tell you the truth. Why aren't they starting vaccinating for another 7 or 8 weeks? I don't really. I mean, Australia's done so well, and we'll see another example of that. And yet they're delaying vaccination. They don't need to. They could get supplies of the Oxford vaccine pretty quickly. They can produce it in Australia. There's a production plant in Australia. Why don't they make it? Why don't they make a start? I really don't understand. That the safety data is there, the efficacy data is there. Why is Australia not starting? Stuck, don't know that one. Then they're going to do 80,000 a week, ramping up, finishing in October. Relatively small population in Australia, but why are they not starting? I really don't know. I really don't know that one. Now, there's been a community detection. Now, what happens is basically flights into Australia have basically been stopped, international flights. But there's still 36,000. There was way more, but there was 36,000. Well, there is now 36,000 Australians stranded abroad trying to get home to their families. It's a terrible situation. But of course, Australia hasn't had any community transmission for some time now, or essentially none. So they've done a remarkably good job by stopping flights, whereas in the UK, we've just carried on flying. We only suspended flights from South Africa about a week or two back. Unbelievable. We just carry on flying as if there's no issue. And, well, not quite as bad as that. There is much less flights. But Australia basically stopped them. And it allowed, of Australians stranded abroad who are allowed to go back to Australia, it allowed 5,000 a week, and they all go to supervised, quarantined hotels. So 5,000 a week allowed to go back. Now, because of this current risk of the 2012 B117 mutation, the new variant getting established in Australia, they've tightened that down to 2,500 now. So Queensland, there's been one case of the new variant. It was a person released from quarantine in Victoria, and then they went north to Queensland. They were in quarantine for 10 days, which of course is good. But they tested positive in Queensland after they'd been released from quarantine. So this isn't a good situation. They tested positive after they'd been released. Now, the news reports don't say how symptomatic or otherwise this person was, but it doesn't matter because they were released from quarantine and in Queensland where they went home, I think they went to their mother's house, that they were tested positive, and it was the new UK variant, whatever you want to call it, Kent variant 2012 new variant, which as we know is 55% more transmissible than the old variant. So that's what happened. Now the Australian doctors have looked at her, and they do believe that they've extended her quarantine, and they do believe she's not infectious, but the risk is there that this new highly contagious variant could get out into Australia, which is the big worry. And Brisbane's had a 3-day lockdown imposed, snap lockdown in Queensland, of course. So Australian authorities very worried that the security that they're taking to keep out the old strain of the virus may not be sufficient to keep out the new strain of the virus. And that concern does make a lot of sense. So far so good though. New South Wales, another one case of the new UK variant detected. Person released from a quarantine hotel. Tested positive in the community. Again, low level of infectivity, but never mind, they'd still tested positive after quarantine. And another 5 cases of the new variant have been detected in quarantine hotels in New South Wales. So until we know otherwise, and I don't think this is true, but until we know otherwise, is it taking people longer to clear the new variant of the virus? No evidence for that. But until otherwise, the Australians are being until it's proved otherwise, the Australians are being very cautious. Are these 2 cases exceptional? Probably, but they're not taking any chances. A snap 3-day lockdown of Brisbane with mask wearing compulsory in that area. Points from that. Quarantine's now mostly 14 days in Australia. No ongoing community transmission detected, so that's good. They seem to have got away with those 2. But people are going back to Australia and testing positive for the new UK variant, which we're calling, I mean, it may not have originated in the UK, it was just first discovered here, but people are testing positive for it in Australia as they return to Australia. And this is very concerning. Another reason in my mind why Australia should start its vaccination programme now. I don't get it. I really don't get it. Does the infection last for longer with the new variant? Probably not, but best to assume it does until proved otherwise. Increased travel supervision in Australia, the sort of rigorous rules you would expect for Australia, which is why they've had such no community transmission, no cases in Australia essentially. So reducing arrivals up until the 15th of February, so there's another 2,500 Australians a week stuck abroad, can't get home, 38,000 waiting to get home. Mandating masks on all flights throughout the flight and in airports, masks at domestic airports as well as international airports. Pre-departure tests for returning travellers. All air crews need to be tested every week. Quarantine in dedicated facilities between international flights for 14 days for air crew. Not much fun for the air crew, going to be stuck in the hotel, but it's the safe way. And this is how Australia has avoided the tragedy that is unfolding in the United Kingdom and the United States. And Australia have shown us how it could have been, but sadly wasn't in the other 2 countries. Australian Medical Association. New variant appears to be at greater risk of breaking out of hotel quarantine. That's a concern. Let's hope it doesn't. It must be stopped before it enters the community. Absolutely. Because if it did get out, it would be hard to get back in. Right, okay, I've got a couple of studies to talk about, but I think that's probably enough for now. We'll do another video with some studies. And I've also got that study on herd immunity to do as well. So we'll we'll do that as a separate video, otherwise I'm going to be going on all day. Okay, but I have an interesting study to show the proportion of asymptomatic transmissions. I'll actually give you the bottom line on that. So 59% of all transmission from a Centres for Disease Control study has been shown to be asymptomatic. and of that, infected people, so 24% are never become symptomatic. So in other words, people that are never symptomatic cause 24% of new infections. People that are pre-symptomatic cause 35% of new infections. In other words, most of the infection, the reason we have a pandemic is because of asymptomatic spread and pre-symptomatic spread. So, but it's nice to get some data on that and confirm it with real numbers. Okay, so we'll leave that there for today. Be aware, tell your friends we are in a crisis. Hospitals are not able to provide adequate care now, or certainly not that's an overstatement. We're not able to provide the care we would normally provide. That's certainly true. And it's going to get worse, and we just need to get the infection rate right down. So don't go out unless you need to, and follow all the precautions that we all know so well now rigorously. But cases, hospitalizations and deaths. Well, cases, we don't know in the UK if cases are going to continue to increase. They are at the moment. We're hoping that the measures that are being taken are enough even for the new variant, but with people's behaviour it may not be. But what we know for sure is hospitalizations and deaths are going to carry on increasing, at least for the next 2 or 3 weeks. That is inevitable. Thank you for watching, of course.